Good morning. I believe we're ready to start. So I just wanted to welcome everyone to the virtual job shadow, the healthcare professional presentation that is being sponsored today by the Center for Healthcare Careers of Southeastern Wisconsin in partnership with Aurora Advocate Health, Ascension, Children's Wisconsin, and Freighted Health. Just as a reminder to everyone, please mute your computers, mute your phones. This will prevent us from hearing feedback or hearing the sounds of things that are going on behind you. It's amazing how easy those things are picked up by our technology. My name is Devonna Williamson. I am a talent business partner at Freighted Health, and I'll be today's moderator. Our featured topic for today is the community services field, presented by our friends at Children's Wisconsin. The professionals that will be sharing information with us today are Chiffon King and Nickhol Ashley. Chiffon and Nickhol, thank you for coming today. Can you guys introduce yourselves, please?
Sure. Thank you, Devonna, for having us. I am Nickhol Ashley, and I am a community connector for Children's Hospital, and I've been doing this almost 2 years.
My name is Chiffon King, and I'm a community health navigator for Children's Wisconsin. I'm a navigator for the Metcalf Park area, and I've been doing it approximately a little over a year, but in other positions, I would say about at least 4 years.
Okay, great. Wonderful. That is actually one of the questions I was going to ask. You know, you're in your current role for a window of time. Have you held other healthcare or other community service focused roles prior to this?
I have. I worked in the healthcare field maybe like 9.5 years, and then I switched over and I became a DV advocate. And then I've just been in the field since then. So, I love doing it. I'm sorry. Go ahead, Ms. Chiffon.
Oh, I'm sorry. I wouldn't specifically say the healthcare field, Devonna. I've worked with Monkey Public Schools. I worked with them for 11 years and served in different positions. But all those positions definitely were working with families, connecting them to community supports and producing self-sufficiency. I think that when I came to Children's, it just gave it more of a title. So, yeah.
Lassoed it all underneath one title for you.
Yes.
Okay, great. Wonderful. As a reminder to students and teachers, if you do have any questions as we go along, please feel free to enter them into the chat box that is part of your webinar page, and we'll work to get those answered. Now, going on to the next question, just give us a little bit of information regarding what your day-to-day average day at work is like. What sort of things do you do?
I'm sorry, was someone speaking?
No, the questions for them will be saved for the end and should be going into the chat box. But if Nickhol or Chiffon, if one of you.
Sure. So I know Nickhol would definitely agree. We do. The first thing I want to note is that we have a calendar, which the connectors and the navigators and schedule meetings with each other and kind of days going. But that calendar is basically just the calendar, as Nickhol would agree. We have our day-to-day. There could be 2 program enrollments on our calendar. And then there may be a parent that is definitely, there's a case that is definitely a high need case. So it kind of fluctuates how the day goes. I know for me, the day, I basically spend most of the day on the phone with clients and assisting with navigation. We may have a client who, like I said, is a high needs case, and you may be on the phone with that client navigating or doing some social support that may approximately take you 2 hours, sometimes 2.5, depending upon the need of the case. We do case consults with one another, case management. Sometimes that takes about 2 hours. So the day pretty much is planned on the calendar, Devonna, but I can't tell you that is exactly how it's going to go.
Yeah.
Great. Nickhol, same thing or?
It's the same thing. Sometimes it's not just the program enrollment. We do have what we call our social needs assessment. And that kind of lets us know the areas where the family has grown. It also helps us with them to set goals as well. There are a lot of Zooms that we do as well. And then we have our case reviews, but just addressing the family's needs at that time. It can be resources like Ms. Siobhan said. It may be stress management. It may be mental health. It's just whatever they need at that time. So sometimes it can take a little while.
And Nickhol, I want to thank you for talking about the social needs assessments. That was awesome, because the social needs assessment, Devonna, definitely highlights the social determinants of health. And it gives us a better outlook of, when we do the assessment for the families, what do they already have in place and what do they need? So thank you, Nickhol, for bringing that up.
Wonderful. Well, you brought up, Chiffon, the topic of program enrollment. Is that sitting down with someone or on the phone or in person and talking to them about what their needs are, or getting them signed up? What is that?
So the program enrollment, we used to be able, of course, before the COVID-19, we were doing program enrollments anywhere from in the community, wherever the family felt safe. We did program enrollments in the home, and that basically we received referrals from. We have exactly 10 community health nurses in 10 Milwaukee public schools. So we received, and Nickhol, feel free to chime in as well. We received referrals from those 10 school nurses. We received referrals from children's clinics located in Milwaukee, and this by word of mouth. And so that enrollment basically entails reaching out to that client, talking a little bit more about what the program is involved, making sure that that client knows that there's been a warm handoff. Like, are you aware that this referral has been put in? Are you comfortable with it? And just talking about what we do and what we don't do. So that gives the family an opportunity to decide if they want to enroll. And once they say yes, we dive right in and go to goal setting and action planning, and just giving that family, asking them what is the vision that they have to complete the goal.
We can't hear you, Devonna.
We can't hear you.
Now you're muted.
Devonna, I see that you're not muted, but we cannot hear you. Maybe you should exit and re-enter. Oh, can hear you a little bit.
Okay. Can you hear me now?
It's a little bit.
Is that working? Hold on. Can you hear me?
It's pretty low.
Hold on. Can you hear me?
It's barely.
Can you hear me?
Yes.
Yes.
Okay, so we have got this headphone thing here that has a knobby on it. And if I touch it, if I look at it funny, it changes its volume on me. And I am still learning how to utilize it. So I apologize for that. What I was trying to ask before I went silent on you was trying to find out whether or not you two ladies could just kind of talk about some of the services that are actually people are being directed to. What sort of help is being provided, resources are being provided to people?
I will say right now, since the pandemic, it's been more on my end as connector has been more for the stress, mental health, and then also to budgeting. That's been more of a priority since the pandemic has started. So that's what we've been working on right now.
People wanting help on how to figure out to pay for things.
Yeah. Seeing where the money is going, how can they start saving? The budget, actually, they're like, oh, I didn't know I was, yeah. So what I'll do is I'll create the budget, I'll put in all the information, but I'll also, I'll make two, because now I'm going to put one in the file, but then I'm going to mail mom hers. And I always advise like, oh, if you put this on a refrigerator, somewhere where you can physically see it. So then it reminds you, you know what? No, we're not going to go out and spend $50 on Domino's today. We're going to put this here. And some of them is part of their goal. Like, I want to buy a house. I want to start saving. So that helps them out as well. And then there's the stress, which I get. The kids are at home. Some of us are working from home. So it's trying to find that balance. So it's like either we're going over certain things. Hey, how about at nap time? This is what we can try to do. So just put different things in place to see how it works. I also send them things in the mail for like meditation and yoga. And in the mental health, we will give them numbers, resources for Milwaukee Health Association, so they can receive those services as well.
And adding on to what Nickhol is saying, one of the huge things as a navigator for children's, the most my families are needing now in regards to support is definitely the housing. And about 95% of my referrals received are for housing. So the families are definitely needing connection to housing supports, shelters, definitely the housing piece, the housing navigation. And along with the housing navigation, we do connect them to those supports. And, for example, when Nickhol talks about budgeting, like what are you able to afford? We have some families who are homeless, connecting them to those supports, whether it's rapid rehousing or public housing, and definitely educating the families while we're connecting them to those supports. For example, from connecting a family who is looking for housing, we're going to do the budget, and we're also going to look up rent for success. Families should definitely be prepared. They should be able to look up landlords to see what their eviction rate is. They should be able to look themselves up on CCAPs. A lot of the families are just not aware of those things. So the education piece, regardless of what we're helping them with, is extremely huge because education is power.
Thank you so much. That is a great
thing. Yeah, I'm sorry. Another thing, I know Ms. Chiffon is really good at doing this one too. We all are, is care mapping. We're doing a care mapping with the families as well.
Mm-hmm.
That is wonderful. That is wonderful. I actually just put in the chat what you said, Chiffon, education is power, so that everyone takes that as a walk away. Again, if anyone does have any questions, feel free to enter those into the chat as well. You've been talking about dealing with moms and dads and the kids. Is that the age range that you work with? Do you deal with the elderly? Is it just women and kids?
Well, for my program, the Connectors program, our program is actually 6 months. It's free and it's voluntary. What we work with pregnant women, single dads, and the kids are ages from 0 to 5 years. The navigators, there is no set limit as far as time-wise, how long they're in the program, and there is no age limit for the navigators. But for the Connectors, it is. And then we do serve all of Milwaukee County as well, where the navigators are stationed in certain areas.
Great. Wonderful. Thank you, ladies. So what sort of training and education is needed for your roles?
For our role is a high school diploma or associate's degree as well, some college education. So that's what's required for our job.
Same for you, Chiffon?
Yes. The community health worker training, I want to say it takes approximately 6 weeks. 16 weeks. It's a pretty extensive training, and it goes through everything from cultural humility to action planning to anything, case management, anything that you could possibly think of. You have to go through the 16 weeks to be considered and actually pass and present, as Nickhol is aware of, present for your group in your class in order to receive the certification to become a community health worker, community health navigator. And you also have to have the passion and the cultural humility. If you don't, I really wouldn't recommend you do this kind of work. And I also want to add that we do, and I know you asked me, Nickhol, what exactly do we help the families with? In return, there's an exchange that goes on when we help the families. We actually are learning from the families as well. So it's definitely a teachable moment as well with the families. I've learned so much working with my families, our families.
Right. Yours. I know, Nickhol, I know you unfortunately need to leave us very, very soon. I wanted to thank you for taking time to chat, and I think Chiffon is going to kind of jump in and try and play your role a little bit. But thank you so much for coming and speaking with us today.
Thank you guys for having me. Everybody have a good day.
Bye.
Bye.
So, Chiffon, in the roles that you and Nickhol do, how much focus do you guys have on, you talked about helping people with budgeting. That was one of the things that was brought up. What skills or abilities are useful in your career? What do people need to maybe study or know about in order to head into your field?
First of all, one of the key things I would definitely point out is the ability to work with an interdisciplinary team. So you'll work with different people that have different styles, that have different ways of supporting families. But when it comes together, you're definitely all together for the good of the family. So, for example, if I'm working on a case and then Nickhol, we do a lot of co-managing. So if I have a family and they have a child that's 5 years and under, then I will refer them to the Connected program with Nickhol. And if there's been trauma or mental abuse or domestic violence, then we refer them to our Project Ujima, which is housed under our program as well. And they will receive a crime victim advocate. So with all that being said, you have to definitely, you're working with different people, you're learning to work with different people for the good of the client, and really working with that interdisciplinary team to come up with a plan to produce better outcomes for the family. You have to be a people person. That would be, yes.
So that cultural humility you were talking about, being a people person, definitely strong skill sets. And it sounds like being able to assess people and what their needs are, what they were telling you, and maybe what they aren't saying.
Exactly. I would definitely say that. And also have that empathy piece as well with the families, but also making the families accountable for where they land. So it's one thing to give them those tools and be empathetic, but also let them know, well, you know what, we still are setting a goal. We still want to work toward that goal. And there's a standard, because once you reach that goal, you're going to feel some kind of way about yourself. You're going to feel empowered that you were able to do this. We just gave you the tools.
Oh, you speak the truth, Chiffon. I know we touched a little bit on the fact that COVID has made everything a little different. Can you just clarify, prior to COVID, because maybe it'll go back this way in a little bit when people get their vaccinations, are you, do you typically go out and about and are on your feet and running all the time? Are you typically sitting behind a computer? I know now you said a lot of phone, but what's the typical physical demand of your position?
So do you mind if I go into the before COVID and then kind of ease into after COVID? Okay. So before COVID, there honestly wasn't a lot of time in the office because we did a lot of home visits, which was exciting to be out of the office and to definitely meet families. And the being out and doing the home visits is just so much more intimate. And then if we weren't doing home visits, we were definitely doing community events at schools, at other organizations, block parties. So we did a lot of outreach. And so, of course, after the COVID, we're definitely remotely working from home. The good thing about it, each has their pros and their cons, but the good thing about it is we're still able to do our program enrollments via the phone. Or we can do our Zoom meetings with our family. Program enrollment, that's another way. So we're basically behind the computer most of the day. And so it's still something that we're working on, still transitioning, because it's been a year.
Yes.
So yeah, definitely.
So a lot of interaction with people. It is not a just sit at your computer and talk to your computer. It's a talking to people, whether it's face-to-face or via computer. Do you have to do any public speaking, group speaking in your role?
Oh, definitely. For example, this presentation, lately it's been much more presentations, Ivana, because everybody's, working remotely. We've done a lot of Zooms, but more presentations are being asked of our department. And so we're doing a whole lot of the presentations as well. We take turns, basically, who's going to present, but it gives organizations, I believe that the COVID has definitely pulled out some creativity. Maybe some organizations wouldn't have reached out as much so, but now families are in need of services. We want to know what a lot of organizations, along with children's, want to know, how can we support families? And so there's definitely like 100% increase in outreach. So we do a lot of public speaking. A community health worker definitely has had that comfort of doing presentations because they may be presenting to families and other groups as well. And so they want to have that peace and that strength and that comfort of presenting. Definitely.
Great. Wonderful. One question that did come through was just to get some clarification. You had talked about, I think it was the navigator role that had to do the 16 weeks of training. How is that training offered? Like, where is it offered? How do people, once they graduate from high school, get into that?
So the community, in order to become a community health worker, to become a community health navigator, is what my role is, you have to be a certified community health worker. And those classes that I took my classes through, and we were actually the first virtual class, is Allied Health. I don't know if anyone's familiar with that, but they're located in Madison. Allied Health is the only one that I'm aware of at this point. I'm pretty sure there's more, but it's a 16-week class. You go to class once a week and you cover just about everything that's possible in the classes. And I'm not advertising for Allied Health, but the classes were amazing. I learned so much that we actually started a support group for the community health workers that they've never started before, that we meet monthly and exchange resources and how things are going.
That's great.
So it's a 16-week.
That's wonderful. Great. Someone else did ask, for those students who decide that they want to go in your direction, your route, is the high school diploma the minimum required education plus the 16-week course that they would need after high school, or do they need?
So when I remember for the community health navigator, is that correct? Or the community health worker?
Do you know both?
I'm sorry to be confusing. So as far as a community health worker, I'm just aware of the high school diploma.
Okay.
I remember filling out and it didn't specify that you had to have an associate's or a bachelor. And then for the community health navigator position, definitely the high school diploma and some college. They prefer bachelors, but in our department, if the experience overrides someone not having that person is hired because they have that passion. And so I have an associate's degree. So I was able to get into the program with the associates and the high school diploma.
Okay, great. Thank you.
And it's in a different field.
Okay, wonderful. Well, there's a question about salary. Salary is going to be easier for people to probably take a look at if you go onto Google and put in salary range for community health navigator or, that kind of a title. It'll give you the average or even sometimes the range, just depending on which site you click on. So that's going to be the easiest way to get the salary information. Benefits in general are going to differ a little bit between hospital system to hospital system, but benefits in healthcare are typically very solid, very good. And if you're working part-time to full-time, you're typically eligible for health, dental, vision, and you get to, receive all EAP, which is Employee Assistance Program, all those sorts of things, which you guys may even do a little bit of work with in your area, Chiffon. So, All right. So what suggestions would you give to a young person who is considering a career in your field?
The first thing I would ask to consider, this is when I worked in the high schools, I would always ask the seniors, what is it that you would do for free? Whatever response that was given, that's basically what you need to be going to school for. So it has to be something you do for free. And you have to have that passion as well. What exactly are you passionate about? Are you passionate about serving people in the healthcare field? And if you answer yes, this definitely is the job that, besides the benefits and the vacation, it's extremely rewarding to help families to see better outcomes. Are you willing to serve? Mm-hmm. Are you dedicated to serving? Mm-hmm. That's one of the things that I would ask as well. And in serving these families, it may be always treat the families as the way you will want someone to treat a family member who's in need in your home. And it just gives you a different approach when serving families.
So just another question for you, just kind of looking at your job as a whole. What do you enjoy most about it? What do you like about what you do?
I absolutely like when my families have learned something, when I'm able to educate them and they're able to bring back that information and tell me what they've learned. It's actually, honestly, Devonna, it's more rewarding than the paycheck that I get every 2 weeks. Because it's one thing to connect families to supports and close the case. It is another thing to know, okay, the goal was met, but the client was able to learn this in case something else happens again, because life does happen. We hope that they stay on that road of self-sufficiency, but the education piece is just them learning, what did you learn from this? So I get real excited about those things.
So it sounds like you get to feed your soul and you also get to get some food on the table in your role. It's a good combination for you. If you enjoy the success of helping others, as part of your role, is there a part of your job that you don't enjoy or that is less engaging for you?
Yes, I can truthfully say all the documentation. There's a lot of documentation. And so, documentation, case notes, documentation, case management. There's a ton of documentation. So I'm still, I would say yes.
That's a part of almost every role out there these days. So, sorry, yeah, and there's no avoiding it. But yeah, cross your I's and dot your T's, other way around. So I wanted to talk to you a little bit about a topic that has been really a focus, I think, for every healthcare system out there these days, and that's been the topic of healthcare disparities. And so first of all, can you give like a layman's definition of healthcare disparities?
Yeah, definitely. I would say a quick one would be disparities among groups who are not receiving the same amount of care as maybe someone else would, may not be, and that could include being tested for something, being basically blown off, just not getting that whole education piece and that whole empathetic piece. So there's a huge gap in the health disparities, just huge.
And healthcare disparities, can be based upon race, gender, religion, all of those things, that the same treatment maybe isn't offered or thought about being offered to someone because of their race or their sexual orientation or their et cetera, et cetera. Because healthcare systems are talking about that and are concerned about healthcare disparities these days, in what ways do you feel that your role kind of helps address or support those concerns for people?
I would definitely, I want to bring attention to some of the health disparities with the families. If I have a family who definitely, one of their goals is to find a PCP, a primary care physician, definitely doing that education piece where I can definitely see why there is a health disparity. A lot of the families that come through and are looking for a PCP, or they're just wanting to discuss or just talking about how they're trying to manage the kids and they have all these other health conditions. They're not even aware of the member advocate line. They're not even aware of, okay, well, what insurance do you have? They'll say Badger Care. And I'm like, well, which insurance exactly under Badger Care do you have? They have no idea. So having that lack of knowledge definitely brings disparities, because what you don't know can definitely hurt you. Educating the families on, okay, if this is how you're feeling, I need you to write all this down. When you go to the appointment, this is what you need to ask the doctor. You want to request this kind of testing because you said you're feeling this particular way. You have a right. Patients' rights is extremely important. And so with our families not knowing these things, the health disparities they're just huge. I had a client recently who wants to get her son tested by a neurologist. And she's like, well, his primary care doctor gave me these doctors and I called and they're definitely not in. They said they don't take the insurance. I said, well, are you aware of the member advocate? And you can actually request that they send something to the home with doctors that are in the network. And she had no idea. So you see how that lack of knowledge, there's just a huge gap in health disparities, just huge.
Wonderful. Thank you so much for sharing. You advocate for and you help people advocate for themselves. So.
Definitely. And even in regards to Devonna, the health client has chronic health conditions, we definitely sit down and do an action plan, and it definitely raises eyebrows for the families because they've never even considered putting together an action plan. So that's another way that the health disparities are huge, and we're able to come in, weasel in, and give them that amount of information for better outcomes.
Weasel in. I like that. Did want to just have you clarify a little bit for me. What other sort of healthcare workers do you work with? Like, who do you work alongside of beyond Nickhol? Like, what kind of roles? Doctors? Are you?
So I've actually had contact since I've been in this position with one doctor, and that was definitely because the client was special needs. And so they had the developmental disability, and then they had the mental health disability. So the doctor did want to speak to the community health navigator who was on the case. The most contact that I have with anyone in the healthcare field is definitely the nurses that are on our team. And that is because they send referrals from schools. And we definitely have to do those case consults with them to definitely, when I receive a referral from a nurse, they're calling me and letting me know just some of the things that maybe they were not able to put into the referral, and to give me a better view of, who I'm working with and what this family really needs. So the nurses are definitely the only ones that I've had the opportunity to work with.
Okay, great.
In the healthcare field. Mm-hmm.
No, that's great. There's people outside of healthcare that you work with, do you, as well?
Oh yeah, definitely. There's a lot outside of the healthcare field, depending upon what the need is for like housing. I do a lot of landlord and tenant mediation. I speak with lawyers, depending if there's an eviction, property managers, do a whole lot of that whole mediation and building those relationships. And then we do have, if there's a family that have previous history of DV or trauma, I deal with the crime victim advocates, and they give them a lot of social support. They do a lot of things if they have had trauma. And then I work with the connectors as well. And then we have in our department, we have a mental health therapist and a mental health manager. And we work with them as well in coordinating mental health services as well. And we definitely work with tons and tons and tons of social workers in Children's Wisconsin. They send a lot of referrals as well. And so I'm a huge fan of social workers. So I love social workers. And so, yeah, we do a lot of case consults with the social workers.
Wonderful. Thank you. Well, we are pretty much at the end of our session today. I truly appreciate Chiffon as well as Nickhol, here in spirit with us for attending today's event. Definitely, if you have any questions about this event or want to learn more about this role, you can go to the Center for Healthcare Careers and do some research on different healthcare careers. But you can also email joan.ward@employmilwaukee.org. And Joan can send out those emails to whoever might be the right person to kind of answer a question that you may have. Thank you so much, Chiffon. It's a pleasure chatting with you. The work that you do is
You're welcome.
Undeniably important, and definitely appreciate it, particularly in this day and age. So thank you so much, everyone. Thank you for your time today, and we appreciate you being here.
Thank you. Bye-bye.
Bye-bye.